Where's the mouse? Where's the mouse? Oh, hi. I'm Indiana Moonjazz John. I recently had open heart surgery, and I'm doing this video to give a few tips for those people who haven't had the surgery yet, especially when you get home from the hospital and you get this massive amount of drugs. It's really hard to figure out how to systematically take them. So I'm going to give you a few tips first. If you finish watching this video, there's a treat. I'll take you in my bathroom and show you my artifact. I have a cell phone used by the Crystal Skull people. Remember that fourth film that Indy did? He's my cousin. And also, there's a beautiful lady in there I'll show you, and a couple other things. First, here's the scar. Runs about 9-10 inches long, and I tell you, the first 2 weeks, 3, it's going to hurt like a son of a gun. But it gets better gradually over time. These pills are going to help you with that and a bunch of other stuff. But as you can see, take a look at this. It's a lot of pills. I need 2 cases to take care of them all. So I didn't get messed up, take the wrong pill at the wrong time, take too many of the wrong thing. We did something that was pretty smart. My wife told me to do this. It's a kind of a pill chart, basically. It's got a list of all these friggin' pills you got to take. They're pretty important though, but we did so they list them 3 things. We put them by what they do, like this one's a blood thinner. It shows the color and shape of the pill, how much you take of it, 3 megs, and of course the name. If it's got 2 names, that's important. The reason that's important to do all that, particularly if you pick them up at the pharmacy, in case they mix up the dosage or the color of the pill, you might be getting the wrong thing and really get messed up in your medication. Don't want to do that. Just want to show you this particular one. It might be your favorite one. It was mine for a while. Vicodin. It's your painkiller, and you're going to need some serious painkiller. Might not be Vicodin, but it could be something like that. You don't want to get hooked on them. You got to use them carefully, but you don't need to be in pain to get better. Okay? I had to take up to 12 a day when I was in the hospital, and a little bit near that when I was coming home. Now I don't take any. And believe me, it helped me. It was hard just to get out of bed and roll over. I also used a chart to help me keep track, especially the Vicodin. I had to take it a whole bunch of different times, like 6 a.m., 10, 2, every 4 hours basically. In case I would forget to take one, I could go back and see if I checked it off. In this case, I was taking 2 a day. Later on, I was just taking 1 a day. And then I would list my total at the end of the day. Same thing with my blood pressure pill. Alright, one other thing that was helpful to have. A couple other things. A pill cutter. Especially helpful for the Vicodin because it's a big pill. Helps to cut it in half. What I don't have out here is it tastes awful. So I usually would have some pudding, applesauce. It's especially good. Have some applesauce. Keep my aspirin there. Keep my nose squirter up here. Okay, that's the main thing I wanted to show you on that. I'll take you into the bathroom, show you the big treats, and it's worth coming in here with me. Alright, I'll be out there. First, a surprise is to get in the bathroom. Alright, here we go. As you can tell, it's exciting. Yep, you're going to need one of these. They won't let you use a straight razor for a while because you'll be on blood thinners, which means if you get cut, you could bleed. You don't want to do that. So pick up one of these. It's good for the environment, and I got used to it too. Alright, here's the biggest tip of all time. To get out of the hospital, get yourself some Phillips or ask for some while you're there because the painkillers are going to mess you up and you will not be able to go to the bathroom. This stuff will help. You can take stool softeners and all kinds of other stuff, but this stuff does the trick. And when you get home, those first few weeks, this also does the trick until you don't need it anymore. I don't need it anymore, but I said, thank you, Lord, for Phillips, or some people call it Mom's Milk of Magnesia. It's the magic stuff. Okay, here's time for the magic shower. Oh, there's a beautiful lady in the shower. It's Mrs. Moonjazz herself, and she is enjoying a little cocktail because we had a special little table put in our shower just for me. Let's show it off. There it is. And it was a little stabilizer when I was taking showers, just in case I might fall down or something like that. That didn't happen. Oh, by the way, what's that she has in her hand? It's the magic cell phone that the Crystal Skull people use. It's quite a big deal. They were aliens. They needed big phones like that. So that's all about we got to say, except we want to say if you liked the video, or even if you didn't like it, give a donation to either your local heart society or a really good hospital, St. Jude's. That's P.O. Box 50, Memphis, Tennessee. Be generous. And if you want some free poems based on my Vicodin dreams, you can write, and I'll send them to you for free, to moonjazz11@spcglobal.net. Some of them are funny, some of them might make you cry, but it's my stuff. If you want to take a look, just give me an email and I'll send it to you. Take care, and thanks for watching.